Welcome back. While many of us are focused on COVID 19, this month is also important for recognizing an entirely different health condition impacting our most vulnerable, Colon Cancer Awareness Month. Joining us now to share more information is Dr. Edward Chu, Director of Albert Einstein Cancer Center and Vice President of Cancer Medicine at Montefiore Medicine. Welcome, doctors. Thank you so much for joining us today.
Well, thanks so much for having me today.
Of course, we are discussing a very important topic, no, doctor. The first thing I wanted to ask is how many people in the US and more specifically in the Bronx are affected by colon cancer? And of course, why is it so important to raise awareness?
Well, colorectal cancer is a major public health problem, here in the United States and globally. So in 2021, there will be about 150,000 new cases of colorectal cancer diagnosed, and it's associated with about 52, 53,000 deaths per year.
Wow.
Globally, worldwide, there'll be about 1.2, 1.3 million cases of colon cancer diagnosed and associated with about 600,000 deaths. So,
Wow.
in the United States and worldwide, it's the second leading cause of cancer deaths. So that's why it really is such a significant problem, even though if you look at the overall survival rates of colon cancer over the last 15 to 20 years, we've seen a pretty significant reduction in deaths, overall deaths resulting from colon cancer. But what's of concern is that we're seeing now an increased incidence of colon cancer presenting at an earlier age, and that earlier age under the age of 45 and 50,
Mhm.
both colon and in particular rectal cancer. Now, closer to home, actually here in the state of New York,
Right.
there will be about 9,000 new cases of colon cancer diagnosed. So in terms of, where we rank in the United States, we're the number 4 state with respect to the number of colon cancer patients diagnosed. And even closer to home, here in the Bronx, we see about 550 to 600 new cases of colon cancer each year.
Wow. Thank you
In,
so
in the
much.
state of New York, it's about 9,000 new cases.
These are some very alarming numbers, doctor. Thank you so much for sharing. Out of curiosity, why are cases surging and why are they projected to surge so high in this year?
Well, so actually, the number of cases has been holding steady at around 100, 145 to 150,000 cases. I think the number that's most alarming to those of us who've been in this field for a long time, and I've been in this field for 30 plus years, um, is the increasing incidence of the younger population. So for a long time, it was felt that the vast majority of colon cancer was diagnosed when patients were in their 60s and 70s. So kind of an older person's disease. But again, as I said, we're now seeing an increasing incidence of colon cancer presenting in the late 30s and early 40s, certainly under the age of 50.
Right. And doctor, why does colon cancer affect Black and Hispanic people at higher rates? What research has been done regarding this phenomenon, really?
Yeah, so most of the research that's being done has been kind of what's called the epidemiology. And in fact, our investigators here at the Albert Einstein Cancer Center and Montefiore have been looking at, the incidence, the increasing incidence of what's called early onset colon cancer, and in particular in our Hispanic and African American patients. So by far and away, the large majority of the early onset um, colon cancer in our community, in the Bronx community, about 56, 57% are African Americans,
Hmm.
and another 35% are Hispanics. And it's interesting, the Hispanic patients are presenting in their mid to late 30s.
Wow.
So African Americans, usually they present in the late 30s, mid 40s. So that's why many years ago, the American Cancer Society recommended that even though for average risk individuals, that's all comers,
Mhm.
that colon cancer screening should start at the age of 50.
Right.
For African Americans, the recommendation has been to start at the age of 45.
Got it.
And that,
So Normally, doctor, we hear, what you just said, a colonoscopy should be done for the first time at 50 years old. But
Yep,
with this
yep.
new data and all this research, now we should be getting it at 30 instead. Is that what you're saying, doctor?
No, so I think now the recommendation is for an average risk individual, colon cancer screening should start at the age of 45.
Okay.
If there's a family history of colon cancer, and especially if someone presents at a younger age, then it's usually 10 years before the earliest onset of colon cancer.
Okay. Got it.
So perfect example. So yours truly has already had 6 colonoscopies done. My
Hmm.
very first colonoscopy was done at the age of 28. And the reason for that is I had some symptoms, but also my mom's youngest brother presented with colon cancer when he was 38. And so if you take 10 years off of that, right, late 20s, and amazingly, that's when I actually started having some symptoms, some red blood in my stool. Fortunately, it turned out to be hemorrhoids,
Hmm.
but um, having been from a family with a strong family history of colon cancer, because actually 2 of my uncles had colon cancer and unfortunately passed from the disease, and then being already involved in colon cancer research, obviously I was pretty focused on making sure that I didn't have colon cancer.
Absolutely. I think stressing the fact that family history is an important aspect of this early onset detection. No, doctor. Can you just emphasize the importance of early detection and also share the benefits of getting a colonoscopy?
Yeah.
Yeah.
So I think plain and simple, colon cancer screening saves lives.
Mhm.
And that with colon cancer screening, we can we can identify the cause of colon cancer, which in the vast majority of cases is polyps. But also with colon cancer screening and specifically colonoscopy, which I think many of us, including myself, feel is the gold standard for colon cancer screening, we can, if there is colon cancer within the colorectal region throughout the whole large intestine, we can catch colon cancer at its earliest stages.
Mm.
And so when caught at its earliest stage, we can cure 90% or more of the patients. Unfortunately, by the time the patients come to see me, the medical oncologist, where we give systemic therapies to treat what's called stage 4 metastatic colon cancer, even though we've now developed over the last 10 to 15 years much more effective treatments, it's still not easy to cure patients. So again, if we can catch colon cancer at its earliest stages, we can cure up to 90 to 95% of patients. So that's why I think it's really important, especially in the month of March,
Mhm.
where we're really trying to highlight the importance of colon cancer screening. And that's why, shows like Bronx Net are so important to really get the word out as to why this is so important.
Dr. Chu, let's say someone's listening right now and they're not sure of the early onset symptoms. What are some of those symptoms that you can share with us?
Yeah. So, the classic symptoms are weight loss, fatigue, reduced appetite, some belly pain or cramps. A classic symptom is a change in either the consistency of the stool, the bowel movement, or so classically it's kind of pencil thin. Okay, it's not the kind of big bulky stool
Mhm.
that one usually sees, but it's kind of very thin. Okay, which would argue that there might be an obstruction in the colon. Or sometimes you can see a change in the color, and usually you might see blood, either red blood in the stool, and that's kind of what freaked me out.
Mhm.
And when I saw red blood in my stool, right? Or sometimes what you can see is kind of what's called tarry black stools. So the school stools are a very blackish color. Um, but what's concerning, and this is why, again, colon cancer screening is so important, is because there are a lot of patients who will have absolutely no symptoms. And so
Mm.
that's kind of maybe one of the first myths about colon cancer is, oh, well, don't worry, I have no symptoms. And I can't tell you how many patients over the years I've seen who had absolutely no symptoms, right? Marines, for instance, who were in amazing shape, they were superstar athletes, yet then by the time they present to me, had widespread metastatic disease.
Wow.
So
So,
that's why even with no symptoms, it's critically important to go get screened. And again, another myth, right, is that, well, I don't need to worry about colon cancer because there's no family history.
mhm.
Actually, the number one risk factor for colon cancer in up to 85% of the patients we see is age.
Wow.
And so again, that's why the vast majority of patients present after the age of 50, but now we're bringing it down to to greater than 45.
Right. Doctor, before we let you go, what are some preventative measures that we can take with either our diets and our lifestyles? Is there anything that we can do to prevent getting colon cancer?
Yeah, so diet, nutrition, critically important. So the things that kind of promote colon cancer, red meats, processed meats, foods that are rich in fat and cream, and foods that have, so unfortunately, my 17-year-old son is a prime example, right? He doesn't eat green leafy vegetables, fruit, or fiber. Well, except maybe for watermelon. But for the most part, he doesn't like green leafy vegetables or fiber.
Mm,
And we know that diets that are rich in green leafy vegetables, fiber, and bran actually can significantly reduce the risk of colon cancer. Not smoking, refraining from alcohol also can reduce the risk. And we also know that physical activity is also very important. So patients who are inactive and who are obese, overweight, that also increases the risk. And interestingly, diabetes,
mm.
when the sugar is out of control, also can contribute to increasing the risk of colon cancer.
Well, thank you so much, Dr. Chu, for sharing all this information with us. Before we go, how can people find out more and contact Montefiore to get their colon cancer screenings today?
Yeah, so people can go to www.montefiore.org, and then they can type in colon cancer screening.
Got it.
And in fact, we have patient navigators. And if you go to that website, there's a number that one can call, and one can learn more about what our cancer center is offering in terms of screening, early detection, and we can also provide important educational materials.
Thank you so much, Dr. Chu, again for joining us on Colon Cancer Awareness Month, March, to share more information.
Well, thanks so much for having me.
Again, Dr. Edward Chu is the director of Albert Einstein Cancer Center and VP of Cancer Medicine at Montefiore Medicine. We're taking a quick break here on OpenBXRX. We'll be right back.